Good afternoon. The teleprompter said good morning, but I think we've moved on a little bit. So, good afternoon, and as with others, and certainly listening to those who've spoken already this morning, it's with great honour and humility that I join you here today, and also to thank the patient safety movement for giving me a second bite at the cherry to share some thoughts with you. For those who weren't here yesterday, I'm the National Director for Patient Safety in England, and the NHS in England has made a commitment involving more than 450 hospitals and organisations to the patient safety movement, and will continue to work relentlessly to ensure that it becomes the safest healthcare system in the world. Every patient deserves safe care, care that is both compassionate and effective at all times, regardless of their condition, sector, or setting. With the support of the Patient Safety Movement Foundation and other aligned national and international organisations, the NHS remains confident in its efforts to make things right when they go wrong. And it stands accountable to support a culture of learning from our mistakes, to ensure a better service for those who use it, and critically, for those in the room, for those who work within it. Within the NHS's commitment to patient safety, we'll build a system-wide framework for reviewing and learning from all deaths and current harms that occur while patients are in the care of the NHS. And our strategy builds upon three elements. We seek to increase our understanding of what goes wrong in healthcare. We will enhance the capability and capacity of the NHS to improve safety, and we will tackle the major underlying barriers to widespread safety improvement. As I mentioned yesterday from my old friend Don Berwick, we will go to work to do our job, but we also go to work to improve how we do our job. We will deliver this strategy by a relentless focus on learning and improvement to reduce avoidable harm and to reduce lives lost due to problems in care. Our focus on safety will continue to contribute to a reduction in avoidable deaths and harms, including reducing unacceptable variation, with national programs of structured case note review of deaths in hospital and maternal and neonatal health improvement to reduce stillbirths and neonatal injury. We will continue to lead whole system programs to reduce harm from sepsis, VTE, acute kidney injury, as well as falls, pressure ulcers, and errors that occur in our mental health and critically learning disability settings. We believe that it is vital that patients, their families, and all clinical and managerial staff treat each other with trust, honesty, and respect. We will make sure that choice, compassion, dignity, and respect remain at the heart of everything the NHS does, with a particular focus on ensuring that everyone has the best possible end-of-life care. Learning on this scale and working in partnership with other healthcare systems around the world will help us meet our own population's changing needs and those of others, particularly in low and middle income countries, as we've just heard from Edna. That's a crucial gain for us, is to help and support those other countries around the world. So I'm privileged to be able to commit ourselves to the work of the Patient Safety Foundation movement, and I hope that you'll help us share with you the ideas that Joe shared with Bill Clinton, President Clinton, about making this a global movement for all countries, particularly low and middle income. Thank you very much for listening. Thank you.